Hi, everyone. I'm Karen Jones, President and Executive Director of the Waha Warriors. And today we're recording the Fall 2025 Washington Update with Dane Christensen and Alejandra Toledo from Health and Medicine Council. If you have any questions while you're watching, jot them down and email them to me at karen@wahawarriors.org, and we'll include Dane's answers at the end of the final recording. Also, check the Warriors Facebook group on Monday for all of the details and registration info for Warriors on the Hill 2025, happening October 8th through the 10th.
Thank you very much, Karen, for that wonderful intro. And thank you, Alejandra, for helping with this presentation today. My name is Dane Christensen. I'm one of the Washington representatives for the Waha Warriors. I am based in Washington, D.C., but if there's one thing I want to remind folks through this discussion, it's that legislators want to hear from you. They don't want to hear from me. They don't want to hear from Alejandra. We can help. We're experts in the process, but you are their constituent. They want to hear from you. They want to know what's important to you. And of course, if you have a rare condition, it's particularly important that they know you and know your lived experience so that they can work on your behalf. Together, we form a grassroots network. We seek to make progress on medical research, on treatment development and approval, and on patient care, access, and out-of-pocket costs. But these victories are your victories and the result of you making your voice heard and all of us working together to form a critical mass of support. In any climate, no matter what the political environment is, you should have every expectation that your outreach will be met with success. If the issues you're talking about are nonpartisan and bipartisan, if you are clear about what you're asking for, you should have every expectation that your elected officials, senators, and representatives will be responsive to you. I want to be clear about that as we work on some advocacy activities this fall and on some key items that are going to help us advance research, patient care, and of course, address coverage and access issues. So really quickly, I think it's important that we level set by saying why advocacy? We don't talk all the time. So sometimes it can be confusing, and I apologize if this takes anybody back to eighth grade or first year of high school civics class, but there's a reason why we do it a certain way, why we advocate, why we make our voice heard, and in addition to it just being a constitutionally protected right. You have a right to go to your members of Congress and tell them what you need. It challenges, opportunities, everything else. Basically, though, of course, we have three branches of government in our representative democracy. We have an executive branch, which is the administration and the federal agencies. The system is not set up for them to take input from their constituents. They take a little bit, they're responsive to public opinion, but they have a different function. They are there to enforce the laws and enact the will of Congress. There's, of course, also a judicial branch, which is the courts. The courts are there to interpret the law. They call balls and strikes. They're not responsive to public pressure either. They're less responsive than even the administration is. Their job is to know who is in their lane. Is Congress doing what it's supposed to do? Is the executive branch doing what it's supposed to do? And they make those determinations. The executive branch has some ability to make policy where Congress has not explicitly passed a law. But if Congress has passed a law, then the law must be enforced. And then, of course, we have the legislative branch. The legislative branch are our elected officials. They are senators and representatives. They are the ones who make the laws. They are the ones who want to hear from you. Even if you didn't vote from them, even if you have a different political ideology, the system is set up for them to take your input. And this is very different from politics and campaigning and who wins elections. This is about the process. So they are there to listen to you no matter what. They don't know who you voted for, and in some respects, it's not important. They don't know what your ideology is, and in some respects, it's not important. You are there to talk to them about what you need for the community in terms of medical research, patient care, treatment development, and there are clear things you can talk to the offices about and expect them to be responsive. And there's a few ways that they are responsive. Congress has certain authorities, which is why it's so important to connect with them. You might have heard phrases like the squeaky wheel gets the grease, or even if you're not at the table, you're on the menu. This is part of being representative in a representative democracy. The first is that Congress has the power of the purse. They decide how tax money is spent, how much money goes to medical research, how much money goes to patient care, how much money goes to the FBI or the Department of Agriculture is determined by the House and Senate in a given year. How much, where it goes, what it's used for, and they're relying on input from their constituents to make these decisions. Of course, if you're a rare disease community, very important for you to make your voice heard. and not simply be overlooked as other folks are making their voice heard. But they are responsive to everyone. Not everyone takes advantage of the opportunity, but if you do, they very much appreciate it. They also create policy. They like creating policy, and they have oversight of federal agencies. So what research the NIH is doing, what work the FDA is doing, what the Centers for Disease Control and Prevention is doing. They want to know about that, and they want to know if it's working for you. If it's not, they're going to ask these agencies, what can you do for this community in particular? And when I say creating policy, of course, I mean passing laws. Congress can pass a law and do lots of things. They can say, we need this, that, or the other thing. But of course, there's a process to that. If you remember Schoolhouse Rock, bill has to pass the Senate, pass the House, get signed by the president. It's a long process. It can be frustrating, but it's not the only process. They can also advance things through the appropriations process and through simply their normal oversight of federal agencies. But they can't work for you if they don't know what you need them to do. Then to level set, what are some of these healthcare agencies that have such a big role in American life? There's a few on a compendia. So it often starts with medical research, breakthroughs, basic science. That leads to industry developing treatments and commercializing them. And then you get into issues like coverage, access, out-of-pocket costs. The research part is handled by the National Institutes of Health primarily. NIH is the world's foremost biomedical research enterprise. They are funded about $46 billion annually, but that money doesn't stay in the government. That money goes out to researchers across the country, to Baylor, to Tufts. Scientists are competing for proposals with their best ideas. The more money there is for science, the more of those proposals get funded, the more quickly science moves forward. And of course, if your research portfolio is relatively modest, even a few grants can make a huge difference. So the high tide raises all boats. The more money there is for research, the more money there is for our researchers. You can think about it that way. Next up is the Food and Drug Administration. FDA does not develop drugs itself. Industry does that. When NIH has breakthroughs, industry often commercializes them. They take the things that are learned, they take the Nobel Prize ideas, they turn them into treatments for patients. That's the way the system works in America. The FDA, though, determines how quickly things come to market. They balance safety and efficacy. And once again, if you're a rare condition, they might not know your experience. It might be tough for them to make these decisions if they're not experts. Your voice and your work with Congress can help inform that. And of course, there's the Centers for Medicare and Medicaid Services. As the name suggests, they manage Medicare, they manage Medicaid, which are very large programs for coverage, but they also set the standards for private insurance and everything else. So whether it's employer provided coverage, Medicare, Medicaid, coverage, access, out-of-pocket costs in general goes through CMS, and CMS is answering to your elected officials. One other honorable mention we would like to add on here, the CDC, the Centers for Disease Control and Prevention. CDC does professional education, they do public awareness, they do data, surveillance, epidemiology, and tracking. So once again, knowing who's affected, how to help, making sure doctors can recognize certain things, all of this comes back to the public health agencies and their role with our elected officials. So what do advocates do when we form that grassroots network and that critical mass of support? Everybody has 2 senators and 1 representative, but they can't do this alone. They have to work with their colleagues. And these issues are bipartisan and bicameral, meaning you want both sides of the aisle, you want House and Senate, you want everybody in agreement. There's strength in numbers. But what we do on an individual level is we educate. There's a lot of folks who were not doctors before they came to Congress. And even if they were a doctor, how much would they know about warm autoimmune hemolytic anemia or similar rare blood disorders? We need to give them that information. We educate more than anything. We tell them what our experiences are. We tell them about where treatments are at. We tell them about out-of-pocket costs. We tell them about our access to care, or things like being in a rural area and having a hard time seeing a doctor. We are true arbiters. They know you have a pure self-interest, whereas others in the community might have a monetary interest. So they want to know how the system is working for you. We educate more than anything. We do that in an honest way. We use our personal stories and our lived experiences to raise awareness. We are telling anecdotes. We are reminding them that we're part of their community, and we're making it local. These folks are from our hometowns, our cities, and our senators are from our states. So where do you get care? Where did your kids go to high school? All this matters to them. They're part of that same community. And then what's happening locally matters too, even though we keep track of what's happening on the policy level, and then we use it to ask for a specific action at the correct time. If you show up at the end of the year and say, we need more funding for medical research, your members are going to say, that's great, but I wish you showed up in February or earlier when we were working on the bills. The bills are almost done now. Maybe we can help you next year. So Alejandra and Karen and I can help guide when the right time is and when to take action, like with some of our upcoming advocacy activities. But you reaching out when those opportunities emerge is helpful. And all of us using the same talking points and saying the same thing makes it very easy for elected officials to work together and advance these initiatives in concert. So what's happening in Washington? We had an election last November. That election led to a number of changes in the House and Senate. This is a presidential election, and it was also a congressional election, but it was a sea change election more than anything. And it was a sea change because it brought a lot of new members in. This is something big. Normally, Congress might be adding a couple new members. There are some swing districts that change hands, balance shifts between Democrats and Republicans in the House and Senate. This was a big time election. There were about 70 new House members out of 435. There were also 10 new senators out of 100, and there were major changes in leadership. This wasn't folks that have just been there for a couple minutes and decided that they weren't coming back. This was people who had been in positions of power for a long time. The head of the Appropriations Committee, the head of the Energy and Commerce Committee. These folks all left, allowing new folks to take those leadership positions and new members to move on to some of these key roles. But once again, the most critical thing when you're doing this is education. When you have new members, people who maybe were running car dealerships or working as nurses or teachers last year, and now they're an elected official, education is key. They need to know you, they need to know your condition, and they need to know the community. And they will work for you no matter what, whether what party they're with or no matter who's in charge. Of course, we have a new president too, but we don't exactly have a new president. Donald Trump's the first person since Grover Cleveland to serve 2 non-consecutive terms. So we know a little bit about what the administration is going to do from when he was the 45th president. And we know that there's a big focus on media and PR. We have free speech in this country, and you can say anything you like, but saying stuff in front of a camera doesn't make it policy. There's a lot you have to do to turn something into actual policy. You can say you want to eliminate the Department of Education, but ultimately Congress has to eliminate the Department of Education. It can't be done by fiat. It has to be done with a bill that passes the House and Senate and everything else. So the phrase is the administration proposes, Congress disposes. They put out a lot of ideas. But Congress ultimately decides what moves forward. And they do that not because it's what the White House wants. They do it because it's what constituents want, you. And they're relying on your input to know what the right thing to do is. So there also is a preference for executive orders. All executive orders are not created equal. Some can make policy. The courts decide this. Others are more symbolic. So just because something's in an executive order doesn't mean it had any effect at all. Congress ultimately is what is making policy, guiding research, guiding patient care, and working on these issues. They're taking input from the White House, but they're doing it through the normal legislative process, which is a constituent-driven process. The phrase we use is it's a member-driven process, and members are driven by you because they work for you, and they appreciate that, and they appreciate your input. So what's happening on the congressional legislative agenda? And this is a timeline. The first thing Congress wanted to do when they took office was pass something called the One Big Beautiful Bill Act, HR 1, or budget reconciliation. The reason they wanted to do this first is because they're on a ticking clock. This is a mechanism that just requires a simple majority. Nearly any bill that goes through Congress has to have Democratic and Republican support. Only the ideas that are middle of the road and broadly supported ever get done. It's why we hear about the same divisive issues over and over again. The only thing that can get passed is things that everybody agrees is a good idea. If there's disagreement, it's not a tug of war where one side wins and one side loses. Nothing happens. An exception is budget reconciliation, where you just need a simple majority. So who's ever in power has narrow ways that they can make changes. So they wanted to do HR 1, budget reconciliation, before time ran out at the end of the fiscal year, which is September 30th. They also are working on the FY26 appropriations process. This is the annual funding bills, how much for NIH, how much for FDA, how much for the FBI. Um, all of this is being decided right now, but these are must-pass bills. So you can make a lot of policy in a bill that has to get done. If they don't pass the spending bill, there's a government shutdown. So they always pass the spending bills. So we're going to have policy on medical research and patient care. The important thing is it includes our priorities too. This is an ongoing process and one that will wind up at the end of the year. And then Congress is in session for 2 years. They're going to work on a number of patient care legislation items too. Once again, Schoolhouse Rock, you might remember if a bill doesn't get passed in one Congress, it has to be reintroduced in the next one and start the process over. So unlike the spending bills, which always get done, if a bill didn't get there quite yet, then it has to start over and try to get there again. Every time it gets a little bit closer till it reaches that tipping point. We have a few bills that are very close to that tipping point right now. But just as an example of how this works, there was a bill called the Genetic Information Non-Discrimination Act previously, or GINA. GINA said if you get tested to figure out if you had a predisposition for certain diseases, then you can't be denied a life insurance policy based on the results, and your employer can't fire you. This seems like a common sense idea. You want to know if you're at risk for a disease. It took Congress 8 years to pass this bill, though, but when it passed, the House passed it, I think it was 419 to 3. The Senate passed it like 88 to 12. So it gets to that point where it's just, the time has come, but that point can take a while. Usually it's a few Congresses. So we're going to focus on those bills that are close to the end of that journey where we can maximize our impact. So what happened in HR 1 since that was settled? HR 1's a mixed bag. It does cut Medicaid benefits. It cuts them for depending on immigration status. It also cuts them if you're in what's called an expansion state or between 100 and 138% of the federal poverty line. All this stuff is phased in over a number of years, though, so Congress will continue to work on these issues. They'll pull back, they'll make changes, and we'll have input in that process. But they did make changes to benefits for a number of affected people. They also did some interesting things. They included telehealth protections, so they're amping up and maintaining telehealth access through this bill, and they addressed something called Medicare physician reimbursement, the rate at which doctors are paid to see Medicare patients so that access doesn't fall off if their reimbursement is cut. There's a couple of things that almost got passed through HR 1, which are important too. One is a bill called the Kids Access to Care Act, which allows children in Medicaid and CHIP to see specialists across state lines. Common sense solution, but one they're still working on. And they also have the rare disease voucher program at FDA, which needs to be reauthorized to keep incentivizing rare disease treatments. They almost did it in HR 1. They're trying to do it now. They also dropped something called most favored nation drug pricing, but a lot of this stuff is going to be picked up in other healthcare bills like PBM reform. PBM stands for Pharmacy Benefit Managers, if anyone's wondering. The price you pay to get your medications is being scrutinized by Congress right now. They said, we wanted to vertically integrate these healthcare programs. The idea was efficiency would lower costs. Well, they did it, but costs went up. So now Congress wants to change things up a little bit to make sure costs go down for you, the end user. The administration made a budget request to Congress to kick off this fiscal year 26 appropriations process. They asked Congress to cut the Department of Health and Human Services by 22%. They asked them to cut the medical research at the NIH by 40%. They asked them to eliminate the Department of Education. All of this was in the budget request. Congress has not opted to do any of this. They've taken a more traditional approach. They're not reorganizing the NIH. They're not making these funding cuts. And this happened when Trump was the 45th president too. He said, cut medical research funding by 20%. Congress never did it though. In fact, they increased research funding. So they took what the administration was saying under advisement, but really they were listening to their constituents, and their constituents were saying, we need more for medical research, not less. And that's how they responded. We should have every indication that they're going to do something similar this time. And Congress has already started working on their spending bills for the year. They're at the midpoint in the process right now. The Senate has been very aggressively pushing back against what the administration is doing. They didn't reorganize NIH. They didn't reorganize HHS. They didn't cut funding. They basically level funded everything and said, we're keeping it the same as it's ever been. The one exception is medical research. They increased funding for NIH by $400 million. Pretty good. Want a plus up there. They also are telling the administration there are certain policy items they cannot advance. They're pushing back on something called multi-year funding to make sure more scientists get funded. So if you give everybody all the money for like a 5-year grant at once, there's less money to go around. So they're saying, don't do that. Give these people their money every year so more scientists can be funded. And they're pushing back on something called indirect costs, which is how much institutions can use for research. They're trying to come up with a new model, but they've said as we decide on a new way to help pay institutions, we're keeping things the same as it ever was. They do include language supporting warm autoimmune hemolytic anemia research and public health activities. Thanks again to the community. And they do something called the DoD peer-reviewed medical research program eligible conditions list. We want to be on this list by the end of the year in the final bill so that we can gain access to this new research program. Congress has to put us on this list, though, and they're going to do it because we asked them to. So the Senate is largely business as usual with some increases for research and health activities. The House, which is of course not as bipartisan, um, also pushed back on the administration. They didn't reorganize NIH either, nor did they cut its funding. They increased NIH by $100 million, so pretty good. However, the House does not reorganize CDC or HHS or any of these other programs, but they cut some of them. In total, they cut HHS funding by about 6%. But they've said as we go into negotiations with the Senate on a final bill, this is a floor. So it's important for us to advocate and say, you know, what the Senate is doing is a little bit better than the House in some instances, and what the House is doing might be a little better with the Senate in some instances, but we have to weigh in on our priorities. For example, the House does include $100 million for new Make America Healthy Again initiatives. So new money to combat things like childhood obesity and other programs, but new money so it doesn't take away from what's currently there. So in a final bill, it would be nice to have an extra 100 million for public health activities. And there's another program which is important to us. We wanted to get a grant to do public health work through something called the Chronic Disease Education and Awareness Program. The program is currently funded about $4.5 million. So they have a bunch of projects they would like to fund with more money. Well, the House provided a $26 million increase to go up to $30.9 million. That amount of money would fund all the waiting programs. So getting that money would mean that we could probably do new public health work in Waha specifically. So that and the DoD program hit very close to home, whereas the other stuff just kind of creates opportunities in general. But if we're not advocating on these two items, no one else is going to do it. And just to show folks that advocacy works, Congress puts things in the committee reports because people ask them to, or because they're learning about these issues and wanting the more work to be done. This is an example of language that's in the Senate bill that's on rare blood disorders, and you'll see it specifically mentions us. So in addition to the money, $400 more million, they're telling NIH and CDC that they should do more work in this area. The agency will respond to that. This is both the funding function of Congress and the oversight function. So let's talk about some key patient care bills really quick. What are the coverage and access issues that are going on right now that are close to passing? One of those bills is called the Help Copays Act. This bill says if you get copay or premium assistance, then that must be counted to your out-of-pocket maximum. Common sense piece of legislation, popular, about 250 House co-sponsors in the last Congress, but didn't pass. So get it over the goal line this time if this issue matters to you. Another bill is called the Safe Step Act. This deals with step therapy or fail first therapy. If your doctor says you need a treatment and you get switched on to a different treatment, the bill says you have a right to know this is happening. Your doctor has a right to know this is happening. And if you have a serious condition, they can overrule what the insurance company is saying. They can say, no, my judgment was correct. They need another therapy, not the steroid or something else that they have to fail on first. That bill had about, that bill was very popular. Sorry, Help Copays had about 150 co-sponsors. Safe Step had about 250. So even a little bit more popular, been around a little longer. And then prior authorization, if some of you know what prior auth is, it means that they have to check in and get approval first before they can do it. It's a very annoying process and one that's very disruptive for rare disease patients. Prior auth reform had 350 co-sponsors. If you're not familiar with these issues personally, you don't need to advocate on them. But if you've dealt with out-of-pocket costs and copays, if you've dealt with step therapy, or if you've dealt with prior auth, good idea to tell your members about it. And then, of course, if they don't pass these bills individually, they might do them as part of a bigger package on PBM reform that they're working on. They're also going to be doing work to reauthorize the NIH and look at reauthorizing CDC. This is Congress, so new opportunities potentially. They're going to do a bill potentially called Cures 2.1 about bridging the gap between basic research at NIH and getting those to actual treatments that are available to patients and covered by CMS quicker. And they want to do a big healthcare package. So they don't have to pass this stuff individually. They can put it in a big package and pass it. All we need to do is tell them it's important. They need to figure out how to get it done for us, if that makes sense. And then we have some upcoming advocacy activities. Now that we know what the House and Senate are saying, we're going to be doing an FY26 appropriations letter. We're going to share that with the community. It's something that's easy to talk about these issues with your member. You can say, I need you to support this, and here's a clear document that says what you should support in any final spending bill. It will include the bigger stuff on medical research and public health, and it will specifically mention the CDEA program and the DoD peer-reviewed medical research program. They will get specific instructions on how they can help. We can circulate that. We're also going to ask you to help. We have a Capitol Hill Advocacy Day coming up, and we encourage you to make your voice heard across the board. If you want to be an advocate, if you want to get updates, if you want to send information to your members, we have ways to do that. And I will hand it back over to Karen for that quick summary and a reminder on how to submit questions. Thank you.
Thank you so much, Dane. I appreciate that. And you too, Alejandra, for taking care of all of our technical pieces. Like Dane said, as far as questions go, if you have any questions for Dane, put them in an email them to me, Karen@wahawarriors.org. I'll make sure that Dane gets them and we'll include his answers. And again, check the Warriors Facebook group on Monday, and all of the details and the registration for Warriors on the Hill 2025 will be there, which is happening October 8th through the 10th. Thank you so much.